has happened despite our robust zoning system underpinned by extensive network of current fences and stringent sanitary measures. And this outbreak exposes critical vulnerabilities in our conventional disease control system by highlighting the failure of our fragmented responses to contain transboundary disease. For this reason, we have mobilized truly the whole of government, whole of society approach to the current outbreak. We have established the National FMD Command Center, which is chaired by the Office of the President, something similar to what we did with the COVID-19 pandemic. And this ensures the highest level of coordination, and literally all sectors work together and pool resources. And for us, this has really demonstrated the power of One Health approach. Secondly, the President of the Republic, Advocate Duma Boko, has shown us political will in his wisdom by directing through a presidential directive that communities be mobilized to support disease control efforts, including repairing and construction of new fences, controlling livestock movements, which are very key in our communal areas, and supporting disease surveillance to ensure early reporting of cases. And to achieve maximum mobilization of communities, we have launched a multi-sectoral national campaign, aggressively engaging the National Assembly, engaging traditional chiefs, workers' unions, and faith-based organizations to mobilize communities. We recently held a FMD PISO, which brought together key mid-value chain stakeholders, legislators, farmers, traditional leaders, to collectively review and strengthen the FMD prevention, control, and management strategies. Finally, I want to conclude by highlighting that this unprecedented aggression of this FMD outbreak, which is driven by SAT1 serotype, it really underscores the need to treat transboundary animal diseases as a shared regional challenge rather than an isolated national issue, and the urgent need for harmonized regional cooperation, robust livestock traceability, and adoption of a more holistic, proactive approach. And for these reasons, Botswana looks forward to leveraging support of WOAH and other partners to achieve a more coordinated regional response, improved disease surveillance efficiency and early warning systems, establishment of more resilient vaccine supplies, including establishment of antigen banks, closure of knowledge gap regarding circulating field viruses to facilitate timely virus characterization, choice of suitable vaccine, and production of fit-for-purpose vaccines. And we are looking forward to strengthen biosecurity, which is very key for border communities, which are usually dominated by smallholder farmers. Thank you.
Thank you, Minister. I hope we can work together in that regard. My last question, Madame Claude. I heard about AgriConnect, and I want you to tell me more about it. So can AgriConnect, this new World Bank initiative, further contribute to the kind of success stories of controlling transboundary animal diseases? I was wondering whether you can tell me how it could support investments in animal health.
So AgriConnect, indeed, is a new initiative that we launched 6-7 months ago. As a platform to bring together different forms of financing for the transformation of the agriculture and food sector. So it's much broader than animal health and livestock. But the idea is really to be very systematic about combining different forms of financing. So you're going to tell me we've done it before? Yes. And we've heard a lot of examples. There's been success stories when we align well investments An example for us was Ethiopia, where on the World Bank side, we worked with the government to invest in the sector, in advice for farmers, better inputs, roads, putting in place the right policies and regulations to de-risk the sector. And then the private sector came in, and the International Finance Corporation, that is the arm of the World Bank Group that finances the private sector, invested. One example was Ethio Chicken, a private company, and they were able to extend their reach to 3 million farmers, create 38,000 jobs. So really success story. But the idea with AgriConnect is to go from one example to scale, and really taking it at scale across the board, working with other partners. It's a very ambitious initiative, aiming to reach 300 million farmers by 2030 with better services, access to market, access to finance. We launched it with other multilateral development banks, our colleagues from IFAD, African Development Bank, Inter-American Development Bank, and our private sector partners. By now, about 50 countries have engaged. Interestingly, it grew very fast, and when we looked at the first 30 countries and which value chains they had prioritized for investment, 27 of them had prioritized livestock. So really, really a strong demand there for investments, both on the public sector side and private sector side. Opportunities are really I see them at two levels. First is the investment opportunities. So public investments to strengthen surveillance system, laboratory capacity, preparedness, pandemic preparedness, and prevention systems, and so on. But also financing for the private sector, whether it's also their contribution to animal health. We heard it's a joint responsibility. But also investment in the sector, right, to create more jobs, better jobs, value addition, and so on. And the platform is also an opportunity to share experiences, success story, knowledge, etc. And when we have excellent examples of one thing that is working in one country, making sure that we can bring that knowledge to other countries and replicate it. And really, again, it's about moving from specific examples to being very systematic in putting in place those financing. So the public financing for the pure public goods, pure private financing for the private sector, but also all the instruments, the blended finance, the de-risking, the guarantees, and so on, all the instruments that will be in the middle when it's a shared responsibility.
You're making an introduction of our technical item tomorrow, I see. I look forward to seeing AgriConnect in finance. Thank you in action. Thank you very much. That was a brilliant start to the Animal Health Forum. Thank you very much to our panelists, Your Excellencies. Thank you very much. So now I believe we'll take a picture of the panel, as we did before. Where is our photographer? Well, I think we lost our photographer. Oh, here she is. Thank you so much.
You want us to move?
No, you're good. Thank you very much. Thank you. You may leave the floor. Thank you so much. Thank you very much. Now, I will leave you with Gloria and Rosa again, who will lead you through the WOAH Honorary Awards session. Thank you very much.
Oui, vas-y.
Girl.
J'ai combien? Yeah. Thank you, Mariana, and all the panelists for such engaging and insightful discussions. And I hope that over these next few days, we've all gathered arguments and inspiration to better make the case for investment for animal health. Now, before we continue, we would like to take a moment to honour colleagues who were an important part of the WOAH journey and who are sadly no longer with us. As many of you know, WOAH is not only made of staff across the regions and here at the headquarters, but also by the many secondees who contribute their expertise, their commitment, and their experiences to our organisation. They are a valued part of the WOAH family, and their contribution leaves a lasting impact, not only on our work, but also on our community here at WOAH. Today we remember two colleagues whose dedication to animal health and public service continues to inspire those who worked alongside them. Je voudrais inviter.
I'd like to call on stage Dr. Pierre Plimeau to pay tribute to Dr. Caroline Planté, vet surgeon and French official who worked for the organization as expert seconded with WOAH, especially as the sub-regional representative in Brussels. Thank you, Madam, for this introduction. Madam Chairperson, Madam General Director, dear colleagues. I'm honored today to recognize Caroline, with whom I was lucky to work together in this beautiful organization that brings us here today. Caroline has left with us memories of a deeply human woman whose intelligence and professionalism were visible every day. She was rigorous, she had a beautiful vision, but it was the way she behaved that left a trace on each and every one of us. She was very human, and she had a consistent career, always for the benefit of shared the good of all. She was trained in Lyon and in the vet school in Toulouse. She started working for the Ministry of Agriculture, working on key issues such as animal safety, food safety, and international relations. Very quickly, she decided to go across the borders, and she joined the WOAH, first in Africa, in Bamako, fighting against rinderpest, and then in Brussels as the sub-region representative. Within WOAH, she played an essential role to strengthen veterinary services, supporting countries in capacity building, and encouraging dialogue between partners and helping structure lasting regional approaches. In 2011, she joined the World Bank, where she worked for 10 years with a deep commitment in favor of husbandry and animal health, first of all in Washington and then in Dakar. She led big programs, especially in Sahel, close to the field, in tight connection with local authorities or regional organizations and local communities. With her action, she helped emerge public policies that were more integrated and took in consideration all the social and sanitary aspects of husbandry and pastoralism. But what was really striking with Caroline was the way she was so deeply committed on the field, in contact with the teams, always prepared to listen, always prepared to share. She knew how to establish the link between the worlds, the technical expertise, the human realities, the institutions, and the local players. She was bright, curious, very open-minded, determined, and fueled by a lot of energy. She smiled, she had a sense of humor, she always made everybody comfortable. She knew how to help people, support people, encourage people. She made you want to go on with a lot of kindness. Caroline was the kind of woman one does not forget, because she helped projects move on and progress, and because she helped people grow. She leaves behind her a rare print, very professional, very human. In order to remember her, dear colleagues, please stand and applaud Caroline's memory.
Merci beaucoup, Pierre.
Thank you, Pierre.
The delegates of Italy, Dr. Ugo della Marta, to pay tribute to Dr. Mario Latini, veterinary technical assistant seconded by the government of Italy, who served WOAH with dedication, integrity, and exceptional professionalism in the sub-regional representation for Asia in Kazakhstan since June 2019.
Thank you for the presentation. Madame Director General, Madame
General Director, Madam Director.
I take the floor with deep sadness and emotion to remember Mario Latini, an Italian colleague, a highly respected veterinary officer, and a valued member of the WOAH community. His sudden passing the last month in Astana has deeply affected all of us, his family, his friends, his colleagues in Italy, and the many people who had the privilege to work with him at international level. Mario dedicated more than 25 years of his professional life to public veterinary medicine. His career was rich and wide-ranging: animal health, food safety, public health, environmental protection, research, and international cooperation. For many years, he served at the Istituto Zooprofilattico of Perugia, one of the 10 of public veterinary health in Italy institutes, where he held important responsibilities, in particular in the field of aquaculture and aquatic animal health. Since 2019, he had been seconded by the Italian government to the World Organization for Animal Health, working in the regional representation in Central Asia, based in Astana. In this role, Mario gave a concrete and widely recognized contribution to the activities of WOAH in Europe and Central Asia. He worked to strengthen cooperation among countries, institutions, and international organizations. He contributed to important activities in aquatic animal health, PVS aquatic missions, laboratory twinning, the Central Aqua Project, and One Health initiatives developed with the FAO, WHO, and other partners. Mario was a strong supporter of the One Health approach. He understood very well that the health of animals, humans, and the environment have to be protected together through dialogue, cooperation, and mutual trust. But today I would like to remember not only the excellent professional. Mario was also a person of great humanity. He was discreet, serious, reliable. He had the courage to work in complex contexts, far from his country, always with a strong sense of services and responsibility. He was able to build bridges between people, institutions, and cultures. He created sincere and lasting professional relationships. For this reason, his loss is felt not only as the loss of an expert, but also as the loss of a colleague and a friend. For Italy, Mario represented the best tradition of our public veterinary services: scientific rigor, institutional loyalty, openness to international cooperation, and commitment to the common good. Today, here, in the common home of international animal health, I wish to express on behalf of the Italian delegation and the Italian Ministry of Health our deepest condolences to his family, to his friends, to his colleagues at the Istituto Zooprofilattico of Perugia, and to the whole WOAH community. Mario leaves a deep void, but also an important legacy: the example of a professional who served public institutions with competence, dedication, and humanity. We remember him with gratitude, respect, and affection. May he rest in peace.
Thank you very much. We now turn to a segment of this 93rd General Session that is very important to us. We are pleased to gather here as we recognize the recipients of the 2026 Animal Health Achievement Awards. The organization's president, Dr. Susanna Pombo, and the Director General, Dr. Emmanuel Soberin, joined the World Assembly of Delegates in officially recognizing the achievement of the 4 award recipients. These individuals are being commended for their role in animal health and public health.
And today we are privileged to acknowledge 3 Meritorious Award winners. This award is granted annually to personalities in recognition of their scientific, technical, and administrative contribution to the control of animal disease, animal welfare, and veterinary public health.
And we will give the prestigious gold medal to an individual whose outstanding service in veterinary science has significantly contributed to the scientific and technological achievement of our organization. Together, these people embody the highest ideals of the World Organization for Animal Health. I would now like to invite the President to announce the winners of this year's honorary awards.
Thank you so much. In fact, it is my honor to present the Meritorious Award to Dr. Ottorino Cosivi. Dr. Cosivi Dr. Cosivi has made an outstanding contribution to veterinary public health in the Americas and at the global level. Through his leadership at the interface between animal and human health, he has advanced integrated approaches to disease prevention and control over many years. As director of the Pan-American Foot and Mouth Disease and Veterinary Public Health Center of Pan-American Health Organization in Brazil, he led technical cooperation in key areas such as zoonoses, envenomation by venomous animals, food safety, antimicrobial resistance, and foot and mouth disease. Under his leadership, the center has played a central role in strengthening regional preparedness and response capacities. Dr. Cosivi's career has also been marked by strong international engagement. From his early work at the World Health Organization in Geneva to his leadership within Pan American Health Organization, he has contributed to shaping coordinated, science-based responses to complex global health challenges. Through his leadership, he has strengthened collaboration between animal health and public health sectors. Dr. Kozivi's contributions to global veterinary health is both significant and lasting. I am truly honored to present him with this Meritorious Award.
Muito obrigado. Muito obrigado. Distinguido delegado, colegas y amigos, buenas tardes.
Dear colleagues and friends, good evening. I would like to present my wholehearted thanks to those who gave my name and gave their support for me to receive this award, Dr. Emmanuel Souberan, Dr. Mota, and all the people running the American Veterinary Services who supported my name. I'm deeply honored.
With pride and humility in equal measure, by virtue of my time as director of PANAFTOSA. For 16 and a half years, I share hard work and immense satisfaction with a unique and formidable team. So this merit medal rightfully belongs to my team at PANAFTOSA, a team which is now led by Dr. Manuel Sanchez, the new center director, who is here with us today. When I joined PANAFTOSA in 2009, I was nicknamed the extraterrestrial, or simply the alien. It perfectly captured the spirit of my American experience. I arrived as a stranger, learned a new continent, and over time found that I belong to the aspiration and achievement of my team. PANAFTOSA works at one of the most complex frontiers in public health, the point where human life, animal health, and the food we eat all converge, exactly where the next pandemic may arise. Through PANAFTOSA, PAHO has built one of the most important platforms for technical cooperation across the America. And here, the center owes thanks to the government of Brazil, which, through its Ministry of Agriculture and Livestock, has given its support, financially and otherwise, ever since PANAFTOSA was established in Rio de Janeiro. PANAFTOSA's defining contribution is the remarkable progress in controlling foot and mouth disease. All countries of the Americas are now FMD-free, with one exception, Venezuela. The three countries that last experienced outbreak during my tenure, Ecuador, Paraguay, and Colombia, we are each now a single step away from achieving FMD-free without vaccination. Venezuela remains our last collective challenge. The trajectory stands in stark contrast to the continuing spread of FMD across much of the rest of the world during the same period. What the countries of the Americas have achieved is not inevitable. It is the result of sustained political commitment, engaged private sector, scientific rigor, and multilateral collaboration. PANAFTOSA has been leading this process, providing technical cooperation based on science, networking, and knowledge sharing. I must emphasize the critical role of the South American Commission for Foot and Mouth Disease for its accountability to both the veterinary services and primary producer across the member country, which has been critical to this success. Of course, other scourges such as rabies, avian influenza, antimicrobial resistance are critical to the health and well-being of our community. But FMD uniquely structured veterinary services, shape the governmental and non-governmental organizations that implement animal health and welfare, and ultimately determines whether millions of smallholder farmers can support their family. In a world where profound failure of human collaboration have put the word war back to everyday vocabulary, the mission of WOAH and PAO become more urgent and relevant than ever. Let me conclude with a very ambitious goal. Let us wage a world war that is worth waging, a world war against FMD, with this practically feasible eradication as our shared goal. The Americas has already showing the world that it can be done. Let's do it. Thank you very much. Muchas gracias.
Okay, now the next one. I'm pleased to present the Meritorious Award to Dr. Junaidu Maina of Nigeria. Dr. Maina has devoted his decades-long career to strengthening animal health systems across Africa and beyond. As Chief Veterinary Officer of Nigeria and WOAH delegate, he played a key role in reinforcing national veterinary services and advancing coordinated approaches to disease control. His work has supported stronger institutional frameworks and greater collaboration at both regional and global levels. He also provided global leadership as chair of FAO-WOAH Rinderpest Joint Advisory Committee. In this role, he helped safeguard the post-eradication status of rinderpest and contributed to maintaining vigilance against its re-emergence. He also played a leading role in Nigeria's response to high pathogenicity avian influenza. Throughout his career, Dr. Maina promoted evidence-based decision-making and closer collaboration between the animal and public health sectors. It is with great appreciation for his outstanding contributions that I present Dr. Maina with the Meritorious Award.
Excellencies, distinguished President and Member of Council, DG of WOAH, Honorable Ministers, particularly my Minister, esteemed colleagues, ladies and gentlemen, I accept this honor with deep humility and gratitude. To be recognized by the World Organization for Animal Health, an institution that has shaped global animal health for more than a century, is a single honor. This recognition belongs not to me alone, but to the Nigerian Veterinary Service and to the FAO-WOAH Rinderpest Joint Advisory Committee, and to colleagues, mentors, and partners across Africa and beyond that served in this journey. My personal journey began in the 1970s at the University of Veterinary Medicine, Budapest, the school that produced Marek and Awieski. They were 100 years ahead of me. but I take pride in attending the same school they attended. Remember Marek disease and pseudo-rabies. I set out to become a veterinarian, return home, and serve in the field. My field experience began in 1979 when I served as officer in charge of veterinary ambulatory services, investigating outbreaks and leading vaccination campaigns. As a young veterinarian, the field became both my classroom and teacher. There I observed the unwritten rules of African field veterinarian. 1, start the day with a full stomach. It may be an early meal. Number 2, make sure whatever you eat is well cooked and safe. Number 3, when a herder says the cattle is just across the stream, be prepared for a long walk. And number 4, take every opportunity for basic washroom comforts because they are rare. Most importantly, I learned humility, patience, and value of listening to pastoralists, more producers, and communities, drawing on wisdom passed down through generations. This lesson shaped the resilience and discipline needed to serve African livestock, and for much of my career, I walked that path in Nigeria. Sometimes it is the unexpected path that truly defines our purpose. In 2006, when Nigeria faced Africa's first outbreak of highly pathogenic avian influenza, I was called to serve as the chief veterinary officer. It was a moment of intense pressure, but also one that served the strength of local institutions and the indispensable value of international collaboration. One of the toughest decisions I had to make was to recommend stamping out without vaccination. Outbreaks were largely confined to small farms, with poor biosecurity, and the vaccines available then offered very partial protection. Worse, the protocol is cumbersome and lacks a clear exit strategy. In that context, stamping out with compensation was a more decisive option. It was controversial, but grounded in evidence and science. Leadership sometimes means standing by the decision that is right, not the one that is easy. At that critical moment, Nigerian veterinary services, supported by universities, para-professional colleges, and the historic National Veterinary Research Institute, NVRI, which was established in 1924, rose to the challenge. They did not stand alone. Experts from FAO, AU, IBA, and United States and other partners joined the effort. Together, we confronted the outbreak with professionalism and resolve. Working hand in hand with nationally trained veterinarians and international experts demonstrated a powerful truth. Global collaboration backed by sustained investment in African veterinary education delivers lasting impact. Nigeria eliminated avian influenza within 2 years, stands as a testimony to what coordinated action can achieve. And an African proverb teaches us, if you want to go fast, go alone. If you want to go far, go together. Other lessons were equally clear. Public awareness, risk communication, preparedness, and compensation are vital. The outbreak showed that how quickly misinformation can spread and how clear communication coupled with fair and timely compensation can reduce risk and support affected communities and sustain public confidence. But victory can bring complacency. In 2015, the 2015 resurgence of avian influenza in Nigeria reminded us that vigilance must never waver. Rising anti-vaccination sentiments today threaten progress. The EU's representative mentioned this. Even as we record the triumph of rinderpest eradication in 2011, the second disease after smallpox to be wiped out globally. Since 2012, the FAO WOAH Joint Advisory Committee, which I had the honor to chair until 2022, has worked to safeguard this achievement. And it was much later, after some years, that I realized it was Bernard Ballard who really proposed me for that post. But as Mark Carney said, nostalgia is not a strategy. Livestock are more than animals. They are engines of livelihood, biodiversity, and climate resilience. Yet transboundary and emerging diseases continue to spread across borders, disrupt trade, erode food security and sovereignty. The toll is stark. They drive over 20% of global production losses, undermine food systems, and climate goals. We must rebuild trust in veterinary services, anchor decision in science, restore confidence in vaccination, and curb antimicrobial resistance. The stronger surveillance, faster response, resilient institutions, and sustained research investment, united action is our greatest force. Through partnership among governments, associations, research bodies, and international organizations, we can safeguard animal health and strengthen food system. And let us look forward. Africa, as you have all heard from the African ministers today, is home to the youngest population in the world. The future of veterinary medicine will be shaped by their energy, innovation, and courage. We must invest in education, mentorship, and opportunities and empower young veterinarians to lead. Their voices and ideas will carry this profession into the next century. The DG Erie, Professor Apollinaire, who may not be here, is a classical example of what an African scientist can provide at a global stage. And as our friend, Baba Somare, steps in as a DG for WOAH, we don't expect anything less from him. And I think I will take this opportunity to thank the DG WOAH for her foresight. On behalf of Africa, I will thank you. This award reminds us our work is never done. As veterinarians, we must safeguard health, secure food, and lead with integrity, courage, and humility. I thank my colleagues, the government of Nigeria, represented by my honorable minister as entourage, the international partners, WOAH, FAO, AU ABA, AU PAMBA, government, and others. Above all, I thank my family for their patience and unwavering support. This honor belongs to all of you as much as it does to me. Thank you.
Don't forget. Okay, and let's proceed. And now I'm honored to present Dr. Nick Douglas Nwankpa of Nigeria with the Meritorious Award for his significant contributions to animal health science in Africa. Dr. Nwankpa has demonstrated strong leadership in veterinary research, vaccine quality, and institutional development. As Acting Director General of National Veterinary Research Institute of Nigeria, he leads work in research, vaccine production, and disease control. His work supports national priorities while contributing to a broader global health security efforts. He has previously led 2 major continental institutions simultaneously. As director of the African Union Pan-African Veterinary Vaccine Center, he strengthened vaccine quality systems, expanded independent batch testing and contributing to the harmonization of vaccine standards across African Union member states. As acting director of the African Union Inter-African Bureau for Animal Resources, he provided strategic direction for animal health and livestock development across the continent. Through his leadership of international programs, his scientific work, and his commitment to mentoring, Dr. Nwankpa has helped build sustainable capacity and improve access to effective veterinary medicines across Africa. Dr. Nwankpa's contributions to veterinary science are highly commendable. I am honored to present him with his Meritorious Award.
The Director General of the World Organization for Animal Health, the President of the General Assembly, and permit me to recognize all the ministers here and distinguished personalities, particularly my Honorable Minister, the Minister of Livestock Development, Nigeria, Alhaji Idi Mukhtar Idi Maiha, the Permanent Secretary, Ministry of Livestock Development, Dr. Mrs. Chinyere Akujobi, and the Chief Veterinary Officer, Dr. Samuel Anzaku. Esteemed colleagues, representatives of the World Organization for Animal Health, ladies and gentlemen, I stand before you today with deep humility and immense gratitude as I receive this meritorious award. I sincerely thank WOAH for considering me worthy of this honor in recognition of contributions to livestock development and animal health over the course of my professional journey. I must confess that receiving an award of this nature is both humbling and emotional, because no meaningful achievement in our field is ever the effort of one single individual alone. Whatever contributions I've made were possible because I had the privilege of working with outstanding personalities, partners, and mentors from institutions such as the African Union, Food and Agriculture Organization of the United Nations, and WOAH, to mention just a few, across different stages of my career. Each stage of that journey provided opportunities to learn, serve, and contribute to strengthening animal health systems and livestock development. I wish to particularly acknowledge the management team of the Honorable Minister and the Chief Veterinary Officer of Nigeria, who considered me worthy of this recognition and suggested my name. I truly appreciate my family, particularly my wife, Veronica, and our two daughters, Michelle and Nicole, for standing by me throughout the journey. I share this award with you. This speech cannot be complete without appreciating the institutions I've served, beginning with the National Veterinary Research Institute, VOM, the Pan-African Veterinary Vaccine Center in Ethiopia, and the Inter-African Bureau for Animal Resources in Nairobi. I wish to particularly thank Dr. Karim Tunkara, the regional representative for Africa based in Bamako, he was a father, a mentor, and a teacher. I said a mentor and a teacher because he was a mentor when he wants to guide you gently, and he becomes a teacher when he holds the stick. I also thank Dr. Charles Bojo. I know he's very busy now, and he's my organ now. And I thank all the wonderful teams in NVRI VOM, PANVAC, and AU-IBA. This award is not only a recognition of past contributions. For me, it is also a challenge and a renewed responsibility to continue working towards stronger veterinary services, improved livestock productivity, vaccine development, and a healthier future for animals and humanity. I thank you once again, WOAH, for this very wonderful honor. I received it with gratitude, humility, and renewed commitment to service. May God bless you all. Thank you very much.
And now, we will proceed, and it is my great privilege to present this year's Gold Medal Award. And the Gold Medal Award, it will be addressed to Professor Ian Brown from the United Kingdom. Professor Brown has dedicated more than 50 years to advancing veterinary virology, disease surveillance, and international preparedness. His career reflects exceptional service to global animal health and to the scientific and technical work of the organization. Internationally recognized for his expertise in influenza and Newcastle disease, he led the WOAH reference laboratories at United Kingdom's Weybridge Laboratory for over 20 years. In this role, he oversaw major research, diagnostic, and surveillance programs and led large multidisciplinary scientific teams. A strong advocate for translating science into action, Professor Brown has consistently promoted clear communication of complex scientific findings to support policymakers, veterinary services, and industry stakeholders worldwide. As a founding member of WOAH Network and the later chair of its steering committee, he helped establish a key international platform for animal influenza science. His work has contributed directly to global preparedness and response to HPI. Throughout his career, he has remained deeply committed to capacity building, including through laboratory twinning initiatives that have strengthened diagnostic capabilities in many countries. Professor Brown's contribution to science, collaboration, and global health is truly exceptional. It is an honor to present him with his gold medal.
Madam President, Madam DG, distinguished delegates, ladies and gentlemen, I'm deeply honoured to receive this prestigious award. I think it reflects the an award for the international scientific community that has come together in the last 20 years and responded to multiple emergencies connected with animal influenza. It reflects the increasing contributions science has made at an international scale to the ongoing understanding, prevention, management and control of these diseases in various guises. I have been privileged during my career to work with outstanding scientists and stakeholders at both national and international scales. In my early career, I was fortunate to work with and be led by several esteemed colleagues, Dr. Dennis Alexander, Dr. David Payton, both of whom are well known for years of service to OIE, as it then was, and Professor Stanley Doan, an eminent pig pathologist. These colleagues were my core mentoring team. I believe every individual needs these during their working life. My first true involvement with OIE was when I succeeded Dennis Alexander, formerly as the UK reference laboratory expert and nominated lead for avian influenza and Newcastle disease. At the time, Newcastle disease was a more prominent disease, although of course that was soon to change. Dennis had encouraged me and exposed me to matters of international relevance, in particular the critical role that the OIE labs made to developing and maintaining international standards for disease diagnosis and to support trade. At the time, I was also privileged to lead the EU reference laboratory, and this gave me more opportunities to work across international boundaries on common issues and challenges. Thank you to colleagues in the European Union Commission, Bernard van Gotem, Alberto Adamara, Maria Pittman and Paco. I remember clearly undertaking my first formal mission for the OIE in 2006. It had been triggered by the first major transcontinental spread of H5 high pathogenicity avian influenza, with all of the uncertainties at the time about how the virus was spreading so fast. The mission was to the Russian Federation, where we covered thousands of kilometers in days, including reaching into Siberia. Our task was to track the mode of spread and the origin of virus with close examination of wild birds. We received warm hospitality, and I fondly recall the mission lead declining more vodka and TV appearances so that we could write our report for the OIE. Of course, we know now how critical the role wild birds play in the ecology and epidemiology of H5 HPAI. But at the time, there was vigorous international debate and a lot of finger-pointing. The spread of HPAI took the virus into parts of the world that had never seen the disease before, and this required the international community to collaborate, support, and share knowledge, especially in capacity building. I was part of an international group of experts that supported OIE in many ways, including through its twinning program, that was aimed at developing international standards for the laboratory application. The program was a large success and continues to this day across multiple diseases. Helping laboratories build trusted relationships with their competent authorities was, in my opinion, an important part of the activity. I had been fortunate to work with several UK chief veterinary officers and saw the immense value in scientists, laboratory specialists working closely with veterinary and policy colleagues in tackling the disease in their countries. The strong support I received from Debbie Reynolds, Fred Landig, Nigel Gibbons, and last but not least, Christine Milmis, was instrumental in helping me take steps to increase alignment of my science and outlook with that of OIE, WOAH and FAO, whilst also, importantly, supporting the resource commitment of myself and my team to international tasks. The international collective led by OIE recognised that the global community would benefit from an international collaborative group of scientists working together on strategic issues and speaking as a single authoritative voice. In the field of animal influenza, but also recognising the growing zoonotic threat. So in 2005, OFLU was formed, and I am proud to say I was one of the original founding members. OFLU reached beyond the International Reference Laboratory Network, important though that was and still is, and embraced an open network mindset, where anybody could join and contribute. Although the network first focused on HPAI, it quickly organised itself into thematic groups to better focus experts' time and effort, which was given on, and still is, on a purely voluntary basis. The first major test and opportunity was somewhat unexpected. Flu does this, with the emergence of the swine flu pandemic in 2009. And in those early days of that pandemic, OFLU scientists fulfilled multiple critical roles in supporting the international response. The last 15 years has seen expansion in the network, but also the breadth of expertise the network carries. The network has truly embraced colleagues from all continents, and it works because all are respected for their knowledge and their contribution. In the early days, we helped grow the tripartite relationship and response to HPAI. I was lucky to be the inaugural OFLU representative that attended the WHO vaccine composition meeting to share information around the characteristics of the viruses that were causing challenges to the global community. The task has come a long way, with OFLU now firmly embedded in the decision pathway for selecting pre-pandemic vaccine strains and supporting WHO in international risk assessment. I was privileged to chair the OFLU Steering Committee between 2018 and 2025 and had the opportunity to work with many colleagues in WOAH HQ. Too many to name individually, but across the international community in particular, there were some that made a very strong and lasting supporting role. I'd like to thank the three DGs, Drs. Vala, Eloi, and Subiran, for their continued commitment, encouragement and support to OFLU. To Gunalan Pervade, who was ably provided the secretariat function and put up with all that I have thrown at him over many years. To Gregorio Torres, who has always provided sound advice. Thank you to all my international colleagues who made the venture what it is, but special thanks to David Swain and Leslie Sims for their commitment and words of wisdom. Finally, thank you to my wife Yvonne, who is here today, for her support and encouragement. Once again, thank you all and to WOAH for this very special award.
Okay, Excellencies, dear colleagues, this evening we had the privilege of announcing and honoring remarkable individuals whose commitment and leadership have profoundly shaped our organization and the advancement of global animal health. Their dedication, professionalism, and service represent the very values upon which WOAH was built. On behalf of the World Assembly of Delegates, I would warmly congratulate all our awardees and thank them for their extraordinary legacy. Please join me once again in applauding them.
You may be tired now, so I just wanted to tell you that after this meeting, which was a little bit longer than scheduled, we are waiting for you at the cocktail party, which will be here. But just before, we have our master of ceremony, which will just say a few things. But don't forget to come and have a drink with us.
Thank you so much, Director General, for the invitation.
And with this, we bring the first day of the 93rd General Session to a close. And thank you all for your participation.
Please, as you get out, do not forget to leave your headsets at the door, and we meet tomorrow at 9 a.m.
Thank you. Muchas gracias. Merci beaucoup. And Gloria, let's go have a drink.
Yes.